Everybody's talking about President Obama's health care bill and how much it's going to cost, but nobody seems to exactly know what is this bill. And so we asked ABC News medical editor, Dr. Timothy Johnson, to come in and make it all clear, and good luck to you.
Good luck to me, right.
Okay, so we spent an hour listening to it's going to cost this, it's going to... Forget what it's going to cost. What is the bill? Does anyone know?
Well, the reason we're all so confused is the president himself does not yet have his own bill. He's left it up to Congress, and the committees in Congress are fighting about it. We probably won't hear from him directly about exactly what he wants in a bill until sometime after Labor Day. He talks about principles, he wants to reform insurance, he wants to cut costs, he wants a public option, etc. But he has not put out an actual bill yet.
Nor have the Republicans.
Nor have the Republicans. You got 3 bills going through the House, 2 in the Senate, and they're fighting over it, and we'll hear after Labor Day.
Okay, but the president said that people should have the same health care as Congress, as the senators and congressmen, right? So, what do they have? If we're going to have what they have, what do they have?
What they have is an insurance exchange. They're part of the federal employees plan, which means that once a year, they get to choose from a list of private plans that has been vetted by the government to make sure they're good and that they say what they're going to do. And then the Congress and other federal employees get to look at that list and pick the one they want for themselves or their family. Obama has proposed something very similar. He calls it a national health insurance exchange where people can sit down with a list of approved plans and look and pick one. So that's what the Congress plan is. The problem with the congressional plan is it's a very good plan. It's a rich plan. It has a lot of benefits and it costs a lot of money. So if we did that for the whole country, it'd be a big bill.
But that's where the $1 trillion is coming in? Is that what you're looking at?
It could be. We don't know what's going to happen, but sure, that would contribute to it. And as I said, if the national exchange that Obama is talking about turns out to be the options that are on the congressional plan, it's going to cost a lot of money.
Now, I know that President Obama is talking about, you know, the 47 million uninsured people who want insurance and getting them insurance. So how does this affect a person like me? I already have insurance.
Well, we don't know yet because we don't have the details, but what he will tell you is if we don't do anything now, your insurance is going to go up every year, just as it has been for the 10 years, and it's going to cost a lot more, and you're going to get fewer benefits, and God forbid you ever lose a job, not this one, of course, but any job, you want to make sure. Then you won't have insurance. So what he is saying to people with insurance is, if we don't do something now, your insurance is going to get worse and worse and worse, and pretty soon you'll be without insurance.
What do you think? I'm sorry.
That's all right.
I just wonder what you think.
Well, the one thing I'm worried about as a physician is that as we expand coverage, which I think we should do, I mean, let me point out one statistic that just blows my mind. We pay about twice as much per person for health care in this country as the average cost per person of all other industrialized countries put together. Sweden, Japan, France, you put them all together. We pay twice as much per person, and we're the only one that doesn't have universal coverage. So I'm all for increasing coverage. It's the morally right thing to do. It's the medically right thing to do. What I worry about is we'll increase the coverage, and there won't be enough doctors around for people to go to. That's what happened in my state of Massachusetts. We increased coverage. People started calling up to get no doctors taking new patients.
Right.
So unless we increase the number of primary care doctors, the kind of doctors you go to when you think you're sick, along with increasing coverage, we're going to be in big trouble.
So people who don't have primary care physicians tend to go to the emergency room for services. If we could cut that out, would that help bring down the cost?
It'd be a huge advance. There's 2 problems with going to the emergency room. First of all, if you've ever done it, you know how long you wait and how difficult it is and how disorganized it is. And secondly, it ends up costing a huge amount of money for what are very simple problems usually. So if we could get people when they had a cold or thought they had the swine flu would want to go in and see a doctor, they could go in. It would be early on, they'd have a greater chance for success, and it would cost a lot less money.
What about, you know, the skeptics out there are saying, okay, look at the programs that the government has been running, not just regulating running, like Medicaid, Medicare, and even some of the veterans programs. Those are near failure, okay? Some of those are near bankruptcy. How are we then to put our trust in the government to actually run the entire health care program? So what do you say to that and those skeptics?
Well, first of all, nobody that I know of, including the president, is saying the government should run the entire program. They are talking about one option being a public option. Medicare is a pretty good program. I mean, it's got some problems. When you try to take that away from seniors, then there would be
you can't, but it needs to be improved,
It
right?
needs to be improved. Medicaid is a more difficult problem because it's a combination of state and federal, and it varies from state to state. Actually, the VA system, I'm not talking about Department of Defense right now, but the VA system turns out to have a very good program. 30 years ago, it was a disaster, but they really have improved it. So the government does some things well. And let me just say this, you know, one of the big philosophical hassles is the government, as you just brought up.
Sure.
So think of an industry right now that is intensely private, fiercely competitive, but which is heavily regulated by the government to the benefit of all of us. Airline industry, okay? When you get on a plane, whether it's in Peoria or here in New York, you're very glad that the FAA requires that plane to be inspected very carefully every 2 months, that the pilot has to train in a certain way laid down by the government, which is why we don't have crashes with the commercial system, and why we do have, listen to this, 100,000 deaths from medical errors in this country every year.
Because we don't have that kind of system.
Do you think?
Tim, I'm sorry, guys, but before we go, I'm being told in my ear again and again, ask Tim about swine flu. Because we've heard that it's going to be worse and next winter. We don't know what to do about it. What's the story?
Well, the honest answer is we don't know what's going to happen, but there are signals that it could be bad. So we're working on a vaccine. That would be a huge help. Got to get more supplies of Tamiflu. We got to make sure we're organized to get the stuff, the vaccines and the medicines to where it's needed. I think we're ahead of the curve. I think we're planning well now. I have my fingers crossed. If it comes and it's bad, we'll be able to handle it.
Well, that's at least a little bit of good news.
Yeah.
Okay, so about the plan, we still don't know what it is, but you'll come back when you know and tell us. And we thank Dr. Timothy Johnson for being with us, and we'll be right back with Hugh Dancy and Rose Byrne.